tunnel syndrome is a common condition where the nerve is squeezed as it passes through the wrist. This can damage the nerve, which decreases your hand function, as well as causes severe pain and numbness in your hand. It's important to study pain in carpal tunnel syndrome because patients can live with these symptoms for years. They can lose the ability to work and use their hand normally. As well, like many other chronic pain conditions, carpal tunnel is more common in women. Women can experience worse pain symptoms than men, even if the degree of nerve impairment is the same. They can also have worse symptoms after surgical treatment. But we don't know why these sex differences in carpal tunnel pain exist. My research wants to understand if these sex differences could be due to variations in how the brain responds to pain. Most doctors focus on treating the damaged nerve in the wrist. However, many carpal tunnel patients can experience spreading of their pain symptoms beyond their hand into their arm and shoulder, to the opposite hand, as well as a general increase in sensitivity to pain all over their bodies. And these are signs that the pain signals are no longer coming just from the damaged nerve, but from the brain itself. This could explain why women experience worse pain symptoms even after surgical nerve repair. Previously in our lab, we've shown in healthy men and women that they can sense and cope with pain differently, and that brain systems involved with sensing and coping with pain can function and interact differently in men versus women. So to answer these questions, I use a tool called functional magnetic resonance imaging, or fMRI, and this technique takes pictures of the brain which allow us to see brain activity. So with fMRI, I can assess the brain systems involved with pain sensing and pain coping and see how they function and communicate with each other. I also use behavioral tests that measure a patient's physical and psychological response to pain. So with the neuroimaging data and the behavioral data, I can get an overall clearer picture of how these patients' pain systems are working. And better understanding of how pain is represented in the brain in carpal tunnel patients could help us identify those patients who might benefit from additional treatment beyond surgical repair to really get at all their sources of pain.